All right, let me show you how to answer this NCLEX question. So when you are trying to answer any NCLEX question, remember we always look for what the NCLEX is testing from the body of the question before we visit what the stem of the question. Because if we don't know what the NCLEX is testing from the body of the question, we cannot be able to apply the principle of answering that kind of question. Now, the question is saying the charge nodes must transfer right from a particular unit to another unit. So this is the principle of transfer. So now you want to apply transfer principle. So I'm just going to give you the principle of transfer real quick. Now you have a client right in a certain unit. The reason why we are going to transfer a client, let us even talk about the kind of client you can transfer. You can either transfer a stable client or you can transfer unstable client. That's one thing you want to know. Remember, we're transferring them from one unit right to another unit. Now when you are transferring a stable client, the particular unit we are transferring them most of the time don't matter on the NCLEX exam. But when we are transferring unstable unstable client, yes, the unit matters. Now we transfer for two reasons. We have various reasons for transferring, but the commonly tested on the NCLEX exam is you transfer for further care, and you also transfer to make what bed available, right? So this is what you want to know. We transfer for further care, we also transfer to what make bed available. So you need to know this. Now when we are transferring for further care, we transfer what unstable clients. When we are transferring for to make bed available, we are transferring what stable clients. So this is definitely what you want to know, right? So understanding this, now you want to know it's very easy to know unstable clients when you know stable client. So let's define stable client. Now stable client is a client who is free from any kind of symptoms for at least 24 hours. So the NCLEX might just tell you, okay, let me give you an example right now. So a patient who have hypertension, right? They have 170 over 100, their blood pressure reading, right? This particular patient, obviously, they are not stable because yes, this is not within range. Now, the NCLEX can tell you patient have hypertension, right? And they have their blood pressure reading 112 over 68 for the past, let's say for the past 24 hours. Or the NCLEX can say for the past 1 day or maybe 2 days or more. In as much as more than 24 hours, yes, the patient is stable. In as much their symptom is within range, we have appropriate vital sign, no abnormal vital sign, patient is absent from the symptom expected based on that condition. Right. So now what you also want to know is that on the NCLEX exam, uh, we don't determine a patient that is stable or unstable due to the condition. No, we determine a patient that is stable or unstable due to what they are experiencing, right? What they are experiencing. Like now we have hypertension, but if you to know if the patient is stable, we have to look at what they're experiencing, right? It is 170 over 100 blood pressure, so that patient is unstable. But here you can see 112 over 68, so this patient is stable. So yeah, that's basically how we know a stable patient. So now let's answer this question. Now, we know this question is testing on the principle of transfer. So understanding the principle of transfer, the NCLEX also feel like you already know the principle of transfer. That's the reason why the NCLEX is asking you it will be most appropriate for the nurse to transfer the client who is, because the NCLEX want you to know that okay, we are transferring from one unit to another, and this is the reason. So the principle of bed available is that we are transferring what a stable client. So NCLEX believe you know that. So now we are trying to look for stable client. Now this is how I approach the question. So I understand that we don't look at a patient that is stable through their condition. We use what they are experiencing. So that's the first thing I try to always look at. So when I look at what the patient is experiencing, I don't even need to think too much. I've seen that 3 is very stable. Why? Because they said the patient is afebrile. What do we mean by that? Meaning the patient would have absent fever. Now, maybe there's something about that condition that have to do with infection. That is when I have to now look at the condition. And looking at the condition, this is hepatitis C. So it's a condition that have to do with infection. But the NCLEX is saying they are afebrile, not only afebrile, it also mention the period of time, that's 24 hours. And for a patient to be stable, it should be more than 24 hours. We also use this principle with discharge as well too. Right, in order to discharge a client, right, the client as well to need to be stable. So this principle can work as well too. Either the client should be stable for 24 hours, or the client should be able to manage, right, their condition um when they are home. Right. So yes, that's how we decide discharging. But nurses don't discharge, right? The doctor discharge. But if the NCLEX is telling you about something like that, you can apply this principle as well too. So you can definitely see, right? So in order to recap what we've been saying so far, so good. Right. You need to understand what the body of your question is telling you. The body of your question is telling you that we need to transfer a client. So we know we are transferring a client. Based on what? Are we doing further care or making bed available? We are making bed available. So we are thinking about stable client. So I just need to just look at the answer keys and look for a stable client right there. And that's my answer. It's as simple as that. So once you understand your question, you can easily know the kind of principle to apply. So what I teach in my course program is all principles. Right. So if you want to learn principle in a way that once you identify the question you are answering, you can easily apply the principle. I have every principle that is tested on the NCLEX exam. A way that when you go on the NCLEX exam, you already know what the NCLEX is testing you and the principle to apply, and you have the ability to pass in 85 questions. So if you want me to coach you on those principles, you need help. If you fail the NCLEX exam and you want to pass this time around, you are tired of failing, I want you to text me. +1767 613 0769. So text me now, and I'll be able to help you in passing the NCLEX exam in 85 question. My coaching program is for 60 days, right, or less, depending on your plan, right? But I can assure you, you'll be able to pass the NCLEX exam in 85 question, even if you have failed the exam in 150 question, 85 question, or anything between 85 to 150 question before. So text me +1767 613 0769.